Good. Good. So, Caitlin, we got some left thigh numbness, low back pain, stiffness, and then knee achiness, stiffness as well.
Yep.
What activities aggravate those issues or are difficult to perform, or you don't perform like you'd like to?
My thigh honestly is worse when I'm sitting and trying to do homework or any of my hobbies.
Okay.
And then everything else is just, it's awful going to work or like doing laundry or even taking a walk.
What aspects are difficult at work?
I do a lot of squatting and like lifting heavy bins, and that's just hard.
Okay. Okay. All right. Well, let's, we got some x-rays, so let's check out your posture. So I'll have you come over here and pull. Yeah. Carrying over 20 pounds more on the right side of your body. So that's what we got to get you more centered, and that's going to be the key to everything. All right. So let's have you come back around, and then I'm going to have you lay on your back. So right there, and there. Good. Yeah, your right leg's at least a half inch shorter than your right. And you hear people talk about short legs all the time, but we've got to release the pressure here to balance this. Get the pressure off the brainstem. And then the holding we were talking about, we've got to get you standing centered and these legs staying balanced between visits. That's what is going to allow the tissues to actually heal. Let's have you sit up facing that way. Or sorry, other way. You're going to face me. And then you're going to come, lay on your right side. So shoulder, ear in the hole. Slide up just a little bit. Shouldn't be any pressure on the earrings. Slide up a little more. There you go. Good. So for you, we're going to come in maybe 3 inches high with no rotation. We're going to have a level headpiece right here on the atlas. We push, it's very gentle but very precise, and we just hold that pressure. Come on up. So that's new. Seems kind of crazy, but very, very powerful. Let's have you go back and lay on your back for me. Slide down just a little bit. Good. Yes. So your legs are balanced. You won't always feel that difference. but it's very, very good. Let's have you just come up here, just walk up and down the room a couple times. I just want to see, sometimes you can notice things right away. Feel any different at all?
Yeah, but I don't know why.
What feels different, or is just hard to?
It just, like, it feels less hard, like, on my body. Yeah.
Okay, great. And let's check you standing, and let's see. So the posture, sometimes you have to rest for a little while before the posture will correct, and sometimes it'll correct right away. Oh, yeah. What a difference for you. So you're beautiful. You are centered. Weight distribution is even. That's a really, really good response, Keelan. Okay, come on out. Now, we're going to do, so a lot of upper cervical people only do that, and it's because you are changing the alignment of the whole body, but I still think it's very beneficial to just go release tension in the other areas, especially the areas that are bothering you. So, let's have you. Let's have you go face down. Okay, and lift your right leg straight up for me, and down, and the left, and down. One easier than the other.
Mm-hmm.
Which one's easier?
I felt like the left was easier.
Where do you feel the tension when you lift the right?
In my hip.
Like right out here?
Yeah.
Okay. Yeah. So your hip here is externally rotated. Go on your side, facing me, and we're gonna adjust that. Might crack, it may not. You want to see. Good. Come here. Good. Good. A little more. Good. And face down. And lift the right. Good. And the left. Okay. How was that?
It was easier.
Good. Does the left still feel easier, or are they about the same?
I think they're about the same.
Good. Go on your back for me one more time. Good. And then go back face down. I'll check the knees. I think most of the knees where you were just walking so far off center.
Yeah.
And you were carrying so much more weight on one side of your body because of that. Lift your right leg straight up for me one more time. Good. And the left. Good. How does that feel?
Good.
Okay. Come on up. And then I'm just going to have you turn. Just sit, this way facing me. We'll check the knees. When you get that pain and the achiness, where do you feel it typically the most?
Mostly like on the sides.
Yeah, okay. This one's a little swollen. So we're gonna go do a traction exercise, and then you're gonna be good to go. Let's see. The left knee feels pretty good. The right one, there is some swelling, but I wanna see just with you walking more centered. I think a lot of that will clear this up. Just that, but we'll see. We can. I don't want to do too much. I want to let your body kind of receive what we did for today, and then we'll see how you're doing in a few days. Okay?
Go ahead and close your eyes.
Nice.